This is The Gum Guru with Dr. Macon Singletary from North Raleigh Periodontics. This is a show about keeping your teeth and gums healthy and how a healthy smile affects your overall health. Today's episode is called, Are You Tired of Being Tired? You may not need a CPAP or an oral device. 3 to 4 painless treatments may end snoring and improve your sleep.
Welcome to the Gum Guru podcast with Dr. Macon Singletary. I'm Jason Kong. Thanks again for joining us. And we've got a wonderful discussion lined up today. As you heard earlier, our episode is titled, Are You Tired of Being Tired? And you know, Dr. Singletary, this sounds a little different from the first two episodes. You know, I think when we think of North Raleigh Periodontics, I wouldn't think of being tired of being an episode, but we're going to be talking about sleep apnea, and I think this is an interesting place to start. And why not start with why we're talking about this today? Because again, I wouldn't think, well, sleep apnea, what does that have to do with the Gum Guru?
Well, taking care of the oral environment as a dentist or periodontist, this is an area that actually we look at every day. When we look in somebody's mouth, there are signs of potential apnea or sleep apnea that we can see. You know, when you have been diagnosed yourself with it, you sort of become more aware of what's going on and then realize that it's more prevalent than we think.
Yeah, it's one of those things that I think has become more on people's radars over the last, I don't know, maybe 10 years or so. But it's also one of those things that is hard to diagnose because, you know, unless you have a spouse or someone who can hear you when you're sleeping, you may be told, hey, you know, you snore, and then I think most people's defensive reactions are like, well, it can't be that bad. You know, I don't feel anything, or, you know, I don't wake myself up snoring. But how do we diagnose this? What are some signs and symptoms that folks need to look out for when it comes to sleep apnea?
Okay, well, and you're exactly right, because I was one of those people. You know, my wife would wake up and hit me in the side and say, you're snoring, and I'll roll over and you'll wake up the next day, say, you've been snoring. I said, no, I wasn't snoring. And then the same thing, it kept going on until one Saturday morning about a year ago, I wake up and there's an ugly man snoring in my face on her cell phone. And it was sort of telling. So I started researching, you know, what is sleep apnea, what are the ramifications. And so I clench, and I always thought it was a tension release mechanism. And there are signs and symptoms in people's mouths that they may be clenchers. And so that started my journey as, okay, you clench as a tension release mechanism, but also it helps close your mouth and open your airway. So clenchers may be people who snore. And, you know, the question to ask people is, you know, have you been told you snore? And if the answer is yes, which in my patient population, almost 80% of them will say yes. And so it's sort of telling that it's pretty prevalent. And it's significant health-wise.
Yeah, and I want to get into that because the ramifications are pretty serious. But other than snoring and, you know, maybe in your case, recognizing that there's clenching going on, is there anything that we should be on the lookout for when it comes to sleep apnea? Maybe some signs and symptoms that this could be a problem?
Yeah, you know, during the day, you know, if you tend to fall asleep mid-afternoon, or if you're driving and you're losing concentration, you're sitting still and reading a book and you fall asleep, you know, your energy level may not be where it should be, or your ability to concentrate later on in the day may not be there. So, you know, those are sort of superficial signs. More importantly would be, you know, are you waking yourself up in the middle of the night for some reason other than, you know, going to the restroom, you know. So, I would wake up a couple of times thinking it was, you know, I had, you know, phlegm or something and I was coughing, but actually I was choking and gasping for air. And so, you know, that kind of phenomena where you don't have the energy that you need is a really significant telltale sign that you might be having this as an issue.
Yeah, and, you know, luckily your wife was there to record you, and, you know, it sort of hit home, wow, okay, this is an issue here. But for those who maybe might still be in that denial phase thinking, well, this can't be that bad. Well, you know, what are the ramifications of not treating sleep apnea? I mean, you said you were waking up feeling like you're gasping for air. Like that's that can't be good long term.
No, so there are terms that we use in the diagnosis: hypopnea and apnea. Apnea is you stop breathing. Hypopnea means you're still breathing, but you're not getting enough airway, enough air into your lungs. And so, to diagnose that, it's a simple procedure. I'm not going to go to a sleep facility. It's just not me. But so my office bought what we call a Braybon. It's a device that you strap on and take home and come back the next day. It's automatically set to person's weight, to age, and it comes on a certain time. And when you bring it back in the next day, we put it on our computer, and it measures your airway, it measures your oxygen perfusion, your pulse, your heart rate, your ability to breathe in and out. Do you have apnea? Do you have hypopnea? How many times a night do you do this? And so it's a simple test. It's painless. It's just a matter of being able to put the device on, which is simple, and it's important in term to determine what's going on. How severe are you? There's an index there and it's called the AHI index, apnea hypopnea index, and it's how many times during the night, 6-hour period usually it needs to be, do you stop breathing? And this index is key. I mean, mine was like 47, which means I stopped breathing 47 times in 1 hour during the night. And during that time, I stopped breathing 90 seconds several times. My oxygen perfusion went down below 90% for several minutes, and that's not good, actually down to 86. So those are, that's a simple test, but if an individual, when they go to a dentist, what we're looking at is, the tongue, how big is it? Anesthesiologists have what they call a Malpathy score, and it's the back of the throat. Is the tongue, what size is the tongue? Is it, and it goes 1 to 4. 4 being large and it closes off the back. Look at the vault, look at the jaw shape. We look at, do they grind? Are there wear facets on the teeth? As I said, is the tongue crenated, means the indentation of the teeth on the tongue. So those are things that, even a medical provider or, a dentist can see very easily, and those are the simple signs to look at. I mean, sometimes it's just obvious once you start looking at it.
Yeah, I want to go back to the device that you use to help diagnose. Years ago, I thought my wife might have some sleep apnea, and so she had to go to some facility to sleep overnight, and they were observing her. But you have a take-home device that's available that's far less involved than going to a sleep study.
Exactly. It's the Braybon. It's a Metabite is the company, and you strap in a little belt that straps around mid-chest, and then there's a finger cuff, and then there's a device that attaches to the belt that measures your chest rise and fall, and then the pulse, the oxygen. There's a little cannula that fits in your nose. It's it's not uncomfortable. I can't. Another reason why I'm not a CPAP. I can't have anything on my face. It wakes me up. I'm supposedly a light sleeper, and I found out that I am a light sleeper because if I don't have the device I'm using now, as soon as I start snoring, I wake up. Whereas in the past, I didn't realize that I'm not going through my normal sleep cycles. But this device will give a printout, and it gives you the AHI score, RDI score, which is the AHI score plus how many times are you trying to breathe, the effort that you have to breathe. And with that score, it can be mild, moderate, or advanced. And this, this is the diagnosis. And then we get a medical diagnosis. We send it to a doctor that certifies that it's mild, moderate, or severe. And at that point, we seek treatment, give the options of therapy that will help open the airway, which there are 2 or 3 ways to do that.
Yeah, that's really cool that that's available to us. I do want to get back to your story. So you said when you got your results back that you stopped breathing 47 times in an hour at one point, and a duration as long as 90 seconds. I mean, I think about holding my breath for 90 seconds and then how I would feel after that. This has potential for some pretty serious long-term effects, right, if not treated.
Oh, yes. I mean, it's amazing. how fearfully and wonderfully made we are. And when one thing goes out of kilter, it affects everything. It can affect two main phases of sleep. Well, phase one, there are 3 levels of it, and then your REM sleep. And phase one is your body's rejuvenating, it's repairing, and it's flushing out the impurities like in your brain. And the REM sleep, again, it allows the brain to refurbish and reboot, so to speak. And if you're not going through that, it affects hormonal levels, it can affect diabetes, it can affect your weight, it can affect your heart, acid reflux. It's amazing. Heart attacks or hypertension, even cancer. I mean, because this body being able to repair, our body not being able to do that, it puts everything out of kilter. And mainly, more importantly, is you have a protein substance in the brain that produces amyloid, and if that didn't get flushed out, it's dementia. So it's a significant medical problem that we all sort of take lightly. And most of my patients come in, they have hypertension. Oh, okay. And most of these people, when I ask them, you may ever tell you're snoring? They say, well, yeah. And so it's sort of an eye-opening, sort of like periodontal disease. Periodontal disease doesn't hurt, and it's eye-opening when somebody says, oh, you have gum disease. And they say, no, you don't. So, well, yeah, you do. Same thing with the apnea and hypopnea.
Yeah, it's funny how we treat it. We may joke about a spouse snoring or something like that, and you may think, well, that's not something serious. But then when you think about in your instance, well, if I said, well, Dr. Singletary stops breathing for 90 seconds at a time, then it becomes like, whoa, okay, that's something that we need to investigate here.
Yeah, and since have my device, which one way to treat it is what we call a mandibular advancement device. It's like 2 night guards fitted together, and it brings the lower jaw forward. It opens the airway, a non-invasive way of treating it. The other way to treat it is with laser therapy, and then you got the CPAP. Now, if you're severely apneic, you're probably going to need the CPAP machine. And there's different, there's obstructual apnea, there's central apnea, and central apnea is your brain is not telling you to breathe, and that's a whole different category of therapy. But again, to know that's important. But there can be ways to treat it without getting too aggressive.
Well, I want to get into that next because you just mentioned 2 forms of treatment, the mandibular advancement device and also the CPAP, which I think a lot of people are familiar with, that device that you usually strap over your nose and your mouth before you go to sleep. Well, I guess it's mostly on your nose when you wear that while you sleep. And, I can understand why folks would be resistant to that. That's often an objection that I hear. Well, I don't want to wear that, or, it's uncomfortable or hard with you're dating someone and you got to strap on a CPAP. So what other treatment options are available to us?
The CPAP obviously is one. The other is devices that brings the lower jaw forward, and they're different kinds. It depends on the dentition and what's available to attach the device to. Mine is OptiSleep, and it's like I said, it's like a bite guard, one on the upper and one on the lower, and it brings my lower jaw forward. So when I put it in, it automatically opens my airway. And if I don't have that in, what I have found is that if I lay in bed and I'm reading before I go to sleep and I fall asleep, the other night I fell asleep and I started snoring. I woke myself up about the time my wife is getting ready to punch me. Said, "You're snoring." But that device has really made me. I have more energy. I concentrate better during the day, and I'm severely apneic. And I need to take my test again to see how I've acclimated it. Is my oxygen perfusion going up above 90% during the night? The other is laser therapy called night laser, and that's a non-invasive way of treating the back of the throat. The laser light stimulates collagen synthesis, and it elevates the vault of the soft palate and opens the airway. We treat the back of the tongue and the floor under the tongue. And it's about a series of 3 to 4 visits, 21 days apart. But that helps people. And there again, it can be a combination of all 3. People are severely apneic. They may have to have that CPAP still, but they don't have to have the air up as much. CPAP is just a forced air into the nose, and that's all it is. And it dries the mouth out, complicates periodontal issues because the salivary flow is drying up, and that potentiates periodontal disease. And so trying to wean yourself off of that, if you can, would be a great thing to do. But some people still have to use that. But the laser therapy and the mandibular advancement device are the two other options in addition to CPAP.
Yeah, I want to learn more about the laser therapy. So you said about 3 to 4 visits. Can you go into what is entailed in those visits? Does the laser hurt at all? How does that work?
Yeah. Well, first order of business is bring the person's attention to the fact that, okay, I have sleep apnea. A lot of people are in denial. And so that in the medical history, go through things, medication, hypertension, are you diabetic? And then we give them the sleep study. They come in, and if they're severely apneic, we'll just probably send them on to a sleep doctor and let them go ahead and fit them for a CPAP machine. But if we think that they may benefit from the CPAP or laser therapy, then we'll talk about it. And then the laser therapies, it's really, like I said, it's very non-invasive. Doesn't hurt. It maybe you feel a little warmth, and it takes about 20 minutes to do it each visit, 20 to 30. And it's just our ability to use the light of the laser light to stimulate collagen synthesis, and it tightens up the collagen fibers and lifts the vault up. Some people notice immediately their airway open up, and they have the ability to breathe easier. People who are athletic and who run or bike, have noticed that they're able to get more oxygen in because the back of their throat's more open. And it takes about 3 visits. Younger people respond quicker than people over the age of 50. They probably have to have another session, 4 sessions. And usually there's a touch-up session a year later. But we take before and after photos, and we can show sometimes it's immediate. You can see the difference.
Yeah, and I think that's one of the last parts of this episode that I want to touch on is just the before and after. You've kind of talked about this some in the episode, but when you have sleep apnea, you're sort of building up this deficit of sleep where over time, it's kind of a gradual buildup, and if you've been dealing with this for years, it's different from day 1 to day 900. So once you've had this treated, it's got to feel incredible afterwards. You got to feel like almost a new person.
Definitely. And so, one, you have more energy. People who are taking medication for hypertension, people who are diabetic, they're finding that their sugar level is stabilizing easier, their blood pressure is stabilizing better. I mean, it all ties in. Sometimes they're reducing the medication they have to take. And so everything stems from the body's ability to go through the normal sleep cycles. And once you're doing that, adults above the age of 20 need at least 7.7 hours of sleep every night. Younger people need longer sleep. But if you're not going through the normal sleep cycles, it will affect your systemic health. And then getting that back into play is not only going to help acid reflux. People that have acid reflux find that they have less of an issue with that once they can get that condition under control.
Well, every episode you leave us with an action item and some homework that we should do on our own. So what is today's action item?
Well, ask your partner, do you snore? And then the next thing is go to your dentist and say, hey, what do you think? And there are signs and symptoms there. And then get a sleep study done and try to figure it out. Getting a sleep study with us is simple. It's just picking the device up. We show you how to put it on, take it home, bring it back the next day. We put it on our computer, and we can tell you what's going on. Pretty straightforward. And then we go from there.
Well, I think we can all do that, and I'm sure our spouses would appreciate that as well. Don't forget, if you want to learn more from Dr. Singletary, you can go to northraleighperio.com. Thank you so much for listening to this episode of The Gum Guru. We will catch you next time.
If you want to know more about nightlays and how it can help end snoring and help you sleep better, check out Dr. Singletary's website at northraleighperio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleighperio.com.